Hey everyone, Dr. Jason West with Lyme disease awareness, post 17 or day 17. And my post is about how to be unhappy with Lyme disease. Now, wait a minute. No one wants to be unhappy with a disease. So why would I make the post? Well, if you know how to be unhappy, all we have to do is start to reverse engineer that, and then you can be happy. And so here's what prevents a barrier to healing for people that have Lyme disease, Epstein-Barr, cancer, autoimmune disorders, is the comparison syndrome. So we're in my consultation office where we do our workup. We're looking at how we can do the medical history. We're looking at blood tests. We're doing a research project with our medical microscopy. And what happens is the patient, we do the workup, and we're going through and we're like, okay, you've had a exposure or you lived in a tick area. So a lot of times people are coming in with a positive Western blot or a positive IGeneX test, and their spouse is sitting next to them, and a lot of times opposites attract. So one spouse will be fairly healthy, one spouse is fairly sick, and we can take the spouse's blood and we can evaluate and analyze it. And many times they can have some of the Lyme markers, and yet they have no symptoms. And so what's happening? What's the difference? Well, welcome to the world of genetics. Some people have genes that are made out of super glue, like they're amazingly resilient. And some people have, a weak sauce glue, like an Elmer's glue, and it's made for binding paper, not binding really thick stuff. So the genetics are that some people are literally kind of impervious to infections and they don't get sick and they have amazing genes. And so if you want to be unhappy with Lyme disease and accidentally create a barrier to healing, it's why me, or why does my spouse, or why does my ecosystem, or I had a guy that went hunting with 3 hunting buddies. They got in a whole bunch of ticks, and only he has Lyme disease. The other 3 are totally fine. He said, I don't want them to have it, but I can't help but ask, why do I have it and they don't? And so the only way that I know how to answer it is what it is. This is your pathway, whether it's God, whether it's the universe, whether, whatever purpose, whatever lesson that the cosmos wants you to learn, it's just your pathway. And I'm not saying that in a fatalistic sense. What I'm saying is we want to do everything that we can to put people in balance. And if you see the patient success stories that we have, that people were out of hope and out of time and out of options, and I'm Dr. 13 or I'm Dr. 17 or Dr. 21, the most doctor number I've been, I think, is 33, where someone said, I've been to 33 other doctors. Why are you different? And I said, because we take the best of everything that we know and we put it into a comprehensive plan to make you better. But if you concentrate on your path and eating clean and having stress modification and stress release techniques, prayer, meditation, deep breathing, going on a drive, exercise, talking to yourself. My favorite recommendation for people is journaling. When you do that and you live your pathway and not compare yourself to others, it really helps you to heal. And I'm not trying to say that it is a choice. I'm not trying to say it's all in your mind. I am saying I know how that people that have Lyme disease can make it worse, and that's doing a lot of comparison. So we have created a community. It's private but free. If you'd like to participate in hearing more in-depth treatment recommendations, patient success stories, things that you can do at home, advanced treatments in the office, all you have to do is type unhappy in the comment section right below this, and we'll reach out to you, get you an invitation into our private community so that you can learn how to beat other people are beating Lyme disease. This is Dr. Jason West, and we'll see you on the next video tomorrow.